Recording again. Good. Okay. Well, thank you all for showing. Tonight's topic is sexuality, relationships, and where the endocannabinoid system fits in. I will be presenting a slideshow, but hopefully not dwelling on the slides. Let's see what we can get. All right. Slideshow. Wait from the start. Okay, so you guys can see me and you can see the slideshow, right?
Correct.
Okay. So in the mess of slides, we have effects of cannabis, we have the actions, we have state of the science, just where things are generally, the engagement points where cannabis plays a part. If there's time for questions and answers, I think probably it's better for you guys to just interrupt me for the people that are here. And then I have a couple slides that sort of don't fit in the mix because there's so many interesting aspects of cannabis, for example, with tumors and sort of how it affects fertility and implantation. There's just things that I think are relevant to the topic of sexuality and relationships, but don't fit into a clean narrative. And then at the end, we have some DIY stuff for people that are interested in making lubricants or balms or body butter kinds of things at home. It's pretty easy, and I think that's really one of the awesome places that the industry will go is home adoption. Everything that comes into this talk can be found in this folder down below, the bit.ly/seedsex. There are, I don't know, 200 or 300 different papers that refer to sex in different sort of decades and different levels of study. Some of it is animal study, some of it is human study, some of it's survey. All of them are titled and pretty easy to search through. Fascinating stuff. I tried to take what I thought was the most interesting to most people. All right. Some basic assumptions in this talk. I mean, maybe this is pretty obvious, but we're really referring to consenting adult sex here, not really considering things like trauma, not really getting into sort of inadvertent administration or poisoning. This is sort of run-of-the-mill how cannabis can work in the ideal scenario with relationships. It also assumes open communication, which maybe is not a fair assumption in our culture, but some of the best aspects of cannabis in relationships require communication, require people to be open and discussing things honestly. And it's also within a very sexual, it's a very secular and scientific view of sexuality, meaning not religious, not taking sort of fringe views of sexuality. It's pretty plain and plain and dry. Okay. Within the sort of vast scope of relationships and sexuality and sort of the emotional stuff that's involved, the relationship stuff that's involved, I basically broke relationships into physical sort of applications, more emotional, psychological applications, and then stuff which is really strictly sexual. I'm just sort of trying to paint an overarching picture of the talk and kind of where I'm aiming at. This is a brief summary to kind of give the people that don't watch the video very far probably what they came for, and then the rest of it will be more interesting and sort of zooming out a little bit. How does cannabis work? Principally, probably for the majority of people, it's a relaxing agent. Cannabinoids are pushing against stress. They're relieving people's anxiety. They're improving mood, so making people less depressed, as probably is the baseline for the worldwide culture these days. To some extent, reducing daily stressors simply because of forgetting. One of the ways that cannabis acts is at our brainstem and sort of hacks the short-term memory formation system. And that has a annoying effect for some people, meaning they have short-term memory loss, or what they call short-term memory loss, but that actually can be quite relieving for someone to focus in on the present moment. And for this topic, that becomes relevant. And of course, cannabis can amplify or create a sense of comfort, even for the occasions where it's not there. The I guess hacking of our emotional centers to feel blissful. Cannabis also works as creating novel sensations. The change of sensory reception, the way that the nerves are pulling in signaling, is different when cannabis is there. And also the environment in our brains, our cognitive processing of signals from everywhere, is also different when cannabis is involved. If we think about the state of mind where cannabis is there, the whole picture is quite different. There are connections being made which are new and different than everyday sort of connections. There's a sense of difference from normal, really novelty, that has very close connections with human sexuality. Mood elevation, I sort of alluded to this briefly before, up in relaxation agents, but it's a way to feel artificial pleasure. Cannabinoids do activate some of the same receptors that opiates do. We have mu opioid receptors in our brains, and cannabis does touch on those in not as heavy a way and not the same sort of mechanisms, but it does make us feel good. And different than feeling good, it also boosts adrenaline. To feel excited in the moment, to feel a rush of energy and intuitiveness. Not merely physically because of an elevated heart rate, but a sense of physical arousal, in addition to the sort of mental arousal that comes from adrenaline, creates a really ideal opportunity for connectedness, and for two people to be experiencing something new and interesting, and sort of you have to pay attention to that new feeling, but then someone else you're with is also experiencing that, and feeling that newness together is that much more pleasurable. I think I'll refer to that in a sec. Yeah, okay, there's another element of shared experiences that I'm going to refer to in just a sec. It's a little bit different than just novelty. Increasing blood flow, cannabinoids do increase heart rate, and also regionally to genitalia, increased blood flow makes everything more pleasurable. And for someone who's not muted, maybe you could press mute just so we don't have feedback. I hate hearing myself. Systemically, systemically, that's the wrong word. There's also increased blood flow to the brain, obviously lungs, muscles. So all the sort of important parts to being a sexual being are going to have more blood flow, going to have more energy. This would be in stark contrast to someone who's sort of lazy and has poor energy, probably not going to be, up and raring to get them, so to speak. Sensitivity of nerves. This is different than what I was referring to before. There's nerve function, nerve communication, which changes when cannabis is there. There's also a resetting of how sensitive nerves are to their environment. Whether this is to reduce pain or, in someone who's very physically hypersensitive. There are people who are very sensitive to touch. The dialing back of nerve sensitivity can happen for those people, while at the same time in people who are not hypersensitive, you can actually get an increase. You can get heightened sensation for erogenous nerves. So this is an interesting kind of bimodal effect that we see in nerve reception, nerve communication, that seems evenly balancing. For people who are hypersensitive, it tones them down. For people who are hyposensitive, not sensitive, sort of the way they would want to be, it increases theirs. And this idea of this balancing act is sort of a very popular thing about cannabis in the lay public, that people see cannabis as this kind of uniform normalizer. And it really is true at a very microscopic level too. Shared experiences, this is sort of a psychological point I'm trying to make here. In the psychological literature, there's a fascinating study, it must be 30 or 40 years ago now, where two people would meet on a bridge, and the bridge was moving. And they also had experiments, sort of sub-experiments, where they would have people meet and the bridge was not moving. And when there was physical change in the environment, people would report a different aspect of the relationship. They would report feeling closer to these people, or have a deeper connection with them, simply because of the physical sort of shared experience. And cannabis as a physical environment change, brings this opportunity too. And then last but not least, cannabis can work because maybe other options are not working, and people are trying this and hopeful. All right, so that's a lot of summary at the beginning, and the rest is not going to be as dense. But for people who don't watch very long, I wanted them to have something too. All right, so getting to sex, I think, takes some consideration, because not all of the people who are engaging in sex are coming from the same starting place. I sort of paint my thought process about cannabis and sex as three different categories. This is different than the three categories of physical, emotional, and sexual. But there's a lot to organize here because cannabis applies to sexuality a lot. So I think of getting to sex as sort of, there's discomfort. And for the people who are in the state of discomfort and coming to cannabis, they need to be helped toward normal, toward less discomfort. And this is, I'm referring here to general discomfort. So someone who has back pain or neck pain or headaches, or some other difficulties, getting them to normal or comfortable is one section where cannabis can be helpful. And then different than that, feeling comfortable sort of getting to a sexual place, even if someone is starting from quote unquote normal, there's another element there to apply cannabinoids. So that's different than starting from a disadvantage and coming toward normalcy. But from normalcy to getting to a sexual sort of opportunity is also a place where cannabinoids can help. And then once someone is normal, the actual arousal and sort of sexual energy, the sexual essence, the sort of process, the mechanics, is a third place. So these are, totally arbitrary. There's nothing kind of, etched in stone here. This is just my way of organizing where cannabinoids help. So the first part of this, moving from discomfort to comfortable, I'm again breaking this down from physical, emotional, and then sort of sexual. You have regional physical sensitivity, meaning there's some areas of people's body, if they suffer with restless leg syndrome, a lot of these people report that they just can't do anything. Their legs are just constantly itching and aggravating them, and they need to address that before they can ever consider being comfortable enough to consider sexuality. And then hypersensitivity to touch. There are unfortunately thousands of women in particular who have a condition called vaginismus, where they can barely interact with their vaginas at all. And there are options with cannabinoids to help minimize that, to sort of turn the dial down, as I was referring to before. And that's really a regional physical sensitivity application of cannabinoids. Zooming out in a body, there's overall physical discomfort. Someone who has back pain or headaches, or has an injury, or has terrible menstrual cramping, or for women in their 50s who are having menopausal symptoms, hot flashes, vaginal dryness. These are things which I guess sort of blend between regional and general, but they also have applications where cannabinoids can help. And then emotionally, on the psychological end of things, there are plenty of emotional states which prevent sexuality. Whether it's trauma, whether it's anxiety, whether it's obsessive compulsive sort of needs that need to be met, or it's just simple other life priorities like parenting. If the act of parenting is getting in the way of people's sexuality, there's something to be done there with cannabinoids. general anxiety, obviously people can be made more calm with cannabis. Lack of interest, this is a huge problem, for a lot of people who want to engage in sexualities. They don't have interest in it, whether it's from hormonal sort of reasons or psychological reasons. Maybe it's trauma, maybe it's just their experience with sexuality growing up. They don't have the same interest as their partner. And cannabis can help there sort of even the territory between the partners. Lack of self-confidence. This is, perhaps common sense to a lot of people, but also perhaps not well thought of by an equal number of people. Cannabis can help partly through the forgetting strengths that cannabis has, to help people forget about their insecurities, forget about things that bother them about their own body, and just sort of live in the moment. And then difficulty with intercourse itself, being physically uncomfortable. For some people, cannabinoids can help to relax muscle tissues for both partners. And someone who is emotionally closed off from engaging with the act. This is different than sort of generally feeling a lack of interest or generally feeling less confident, but emotionally, physically, or psychologically closed off from the act of sexuality, active sex, can be addressed. And then moving from comfort to getting to sex, being physically able to engage. This is for people who don't have physical mobility. I'm thinking about people with multiple sclerosis or severe lack of flexibility. Cannabinoids can help relax them, can help move them. It's not just people who are just sort of normal and healthy that engage in sex. There's plenty of other people who suffer tremendously, and cannabinoids can help them. And we have to remember that sexuality is not just the people who look and act like us. So physically able to engage obviously means a lack of pain. People have to be in a comfortable place to engage. Psychologically, emotionally, again, we're sort of moving closer to sex, and ways that cannabis can help. Cannabis can manufacture a sense of focus, an ability to overcome distractions, whether they're psychological or physical, and can really hone an availability for participation. This is, I guess, to some extent, the same kind of idea. This focus on participation, which is different than focusing away from distractions. And then sexual arousal itself, with cannabinoids, you have enhanced blood flow to genitalia and other erogenous zones. You have intimacy, so collaborative focus, where two people are sort of engaging in the same milieu, the same sort of environment in their bodies, and can develop a pairing that's really poorly understood, I think. The psychological literature understands it at a very high level. The medical literature doesn't really pay attention to pairing at all. This is sort of a really underappreciated aspect of animal life, is sort of what's going on when animals are pairing. But anyway, cannabis certainly does help. And elevating testosterone. This is an interesting tidbit, because the literature has turned a 180 here. There was a thought through most of the animal literature that cannabis impacts negatively luteinizing hormone, these hormones that relate to men and sexuality. But actually, there were early studies in the 70s and 80s that showed physically less testosterone as people consumed more. And actually, as the literature has grown up, matured a little bit more open-mindedly, this is flipped, and we're now seeing that actually testosterone is elevated when men are consuming, well, when anybody is consuming cannabis. It's not quite that cut and dry, but that seems to be the overall trend. And then last here with sexual arousal was an interesting comment from a study, I don't know what we call it. Back in the day, in the 70s, some doctors used to sort of theorize or hypothesize in public, in sort of printed material. In one such epigraph, or maybe it's epitaph, sexual fantasy, sort of the consumption of cannabis creates fantasy-laden thinking, and sort of an easier time to imagine sexual things and enhance the sort of act itself, in a fantasy sort of mentality. I guess this is sort of a state of mind of fantasy, which is different than the psychological relief or the physical relief. It's just sort of a, I don't know, microscopic thought process. Okay, and then at sex, some of this I think we've referred to already, but creating new shared experiences, improving focus on someone else or on oneself, is a sort of aspect of cannabis in coitus or whatever other form of sex. And partly the short-term memory loss is allowing a clean slate so people can focus on the present moment as opposed to whatever physically or emotionally or psychologically might be bothering them. And then arousal at sex, sensory enhancement. This is subtly different from what I've referred to before. There are components in full spectrum cannabis, terpenes and flavonoids, which actually stimulate directly nerve activation. They're literally titillating nerves if we think about it that way. And there's also subtle changes in temperature. Also, I referred to this before, nerve sensitivity. So there's a lot happening at a local level at genitalia that is creating pleasure or creating novelty, which is different than all of the stuff leading up to sex itself. A lot of these seem different, but they are quite different. A lot of them seem similar, but they are quite different actually when you get down to the different categories that I tried to organize with. The intimacy of sex, so collaborating on a shared goal, pairing is different than collaborating as a relationship and relating as a partnership. And then gratification, when someone is consuming cannabis, the sort of general bar chemically is set closer to satisfaction. No matter what's happening, you're more likely to say, it's all good, man, chill, whatever. And so I think sexuality is maybe the appearance of well, maybe no matter how sex is, it will seem okay, is what I'm getting at here. And then the prolongation of time sense is also something poorly understood by science, but well understood by anecdote. Maybe it's foreplay is just seeming to last longer, or the pleasure of sexuality or orgasm is lasting longer. Okay, it's tough stuff to talk about because we don't really have good semantics in our culture. As far as negatives, where cannabis is concerned, through the literature, we see times where people take too much or take the wrong products for them, and they feel more sleepy or they feel distracted, not less distracted, but more distracted. Maybe the internal environment they're dealing with is so different from what they're used to that it's just distracting, or maybe it just had no effect at all. That could be, either someone is too tolerant of cannabis or didn't take enough. Also, people describe with cannabis on board a lack of interest in sex. Of course, sexuality is very complicated, and it depends not just on someone's body, but their mind and their partner, if there is a partner. And having a lack of interest might be partly distraction. It might be partly, whatever it is that the substance of interest, which has changed. Erectile dysfunction is a big topic that we'll cover in this slideshow. And that obviously affects both men and women. And then inhibition of orgasm could be physical, could be partly psychological, it could be all of the above. This is all pretty complicated stuff and not easy to disentangle. This is a sort of intended to be a cursory slide just to show you that basically every aspect of being human involves the endocannabinoid system. It is everywhere. It is part of everything. And to zoom into fertility, it is intimately part of male fertility, intimately part of female fertility, both in terms of the sexual stuff that we were just kind of highlighting, but also in terms of what it means to be human, what it means to have animals, and sort of the reproductive aspect of sexuality, but also the hormonal aspects too. The takeaway here is really it is part of everything human, and it's impossible to disentangle, really. And as people sort of investigate, oh, what is cannabis doing for my orgasm, or what is cannabis doing for my arousal? It's so interconnected. It's a little bit like disentangling what does that smell when you're at the zoo. It really could be the sheep, it could be the cows, it could be you. This is just a pretty picture about how intimately cannabis is involved in the formation of baby, from embryo development through implanting into endometrium to formation of a placenta to birth. It's the real deal. It's part of being human. And consider this in context of a culture that has demonized cannabis, for women who are pregnant, for birthing, for the sickness of pregnancy. It's really just an unfair reality, and that's not consistent with science. I think I've made this point probably already. It's cannabis, the endocannabinoid system is part of everything that is female reproduction, whether it is endometrium in the uterus, whether it's the ovary and the formation of follicles, whether it's the active sex and the sort of relationship part of sex, whether it's the baby forming and the placenta, and whether it's birth and kind of getting the whole process there. It's sine qua non in Latin, which means without which there is nothing. This was actually interesting for me to relearn. When sperm and ovum meet, they create a blastocyst. This is a sort of limited number of cells that will become a fetus eventually as it implants. In order for this ball of cells to wander effectively down fallopian tubes, guess what? There are cannabinoid receptors and cannabinoid ligands that connect and basically guide the blastocyst where it needs to be. And this was A, fascinating on its own right, but B, also when we think about a woman who is trying to get pregnant and consuming cannabis, the fact that she has exogenous outside cannabis there might distract things. Or if she's taken a couple days off and then is getting pregnant, there actually could be an increased amount of receptors, because receptors ebb and flow as people consume cannabis. So it really is quite a dynamic experience. And one way of understanding that is maybe cannabis could have therapy for fertility and baby making. Fertility meaning the ability to get to a baby and then be the baby itself. But also, the idea that our culture has it so black and white is also silly, because it's just such a dynamic thing. Implantation, suffice it to say, it's just a pretty picture showing it is actually relevant to the endocannabinoid system. I was talking about nerve signaling and sort of how nerves can be made more sensitive or less sensitive. This is a picture of the chemistry that happens locally when between two nerves where they're meeting. There's nothing really to take away here except for the fact that what I'm saying is true. This is a laundry list of parts of females that are involved in cannabis. It happens to be from a study about cancer, and what you can see on the slide is just that things are either increasing or decreasing when cannabis is involved with cancers. It's nothing really to take away from this punchline, from the sex sort of discussion, except that cannabis is involved almost everywhere. And then also thinking about, female reproductive tract and cannabis also comes cancer. This is a slide showing the different kinds of female reproductive tract cancers, where they can show up. And if we think about that in context of cannabis is involved, and then we also think about, wait a minute, I think there's some anti-cancer stuff related to cannabis, you can sort of see the beginnings of the future of cancer medicine and cannabis medicine. All right, so now we're sort of, I try to organize slides from different studies in a consistent way. It's not so easy, but this is one small study that showed cannabis was not helpful, that it was actually harmful for sperm. What you can focus on here is just in the bold on the right-hand column, the p-values showing that cannabis impacted pH of sperm in a meaningful way, meaning they were not comfortable in their acidic environment. There were significantly fewer sperm when cannabis is involved. They're less mobile, and they look weird. The morphology is a little bit strange. This is actually not borne out consistently in the literature. It was really, really common back in the day when animals were being studied and when sperm were studied in a petri dish. This comes out a lot, but one of the points I would make to counter this sort of discussion, while it may be true that the environment that sperm are in, the motility, the total number of sperm might be impacted, and it might be significant. One of the things that is true of cannabis, hopefully from the beginning introductory slides, was that cannabis is also helping people engage in sexuality in a much more regular and enthusiastic way. And even if there are small, significant changes for the worse, the overall increase in sexual activity probably overpowers this in terms of fertility and action. Pelvic pain improvements. This was an interesting study that just showed that cannabis really does work, and this is borne out in clinical practice day in, day out, where women who have pelvic discomfort, which is very common, and to some extent men, but generally much less common, can function in a daily experience with cannabis, even beyond sexuality, just sitting down, just working, just basic everyday life. And some of this is related to menstrual cramping and dysmenorrhea or painful menses, where cannabis can help. But some of it is just sort of physical ailments that are helped with cannabis. Interesting study out of Australia, looking at women with endometriosis. This is uterine tissue that's outside of the uterus itself, and can be really excruciatingly painful for women who are having a period. Instead of the blood draining into a vagina, it sort of could be draining into their abdominal cavity or into their fallopian tubes. But anyway, this study looked at sort of ways that cannabis was helping not just the symptoms of endometriosis, but also nauseousness and vomiting, painful urination, their sleep, depression. I mean, basically this is showing cannabis works, and I think most people who are watching this have already figured that out, but I think the general culture has not yet hooked in. One of the interesting things to take away from this was an old study from the 70s, where doctors would just survey their patients saying, how is this working? What's working or not working? And basically what you can see here is that cannabis increased sexual desire. It's what you can see right under two, and down below, there was not only increased desire, but enjoyment of sexual activity. And this is a pretty low-tech study, but is borne out throughout the whole literature. Masturbation, basically interesting study that showed that post-masturbation, when subjects had their blood tested, that levels of 2-acylglycerol, which is a natural endocannabinoid, were vastly amplified. And some of the other components that relate to the cannabis sort of tree were all amplified. So from this, really, you can take away the endocannabinoid system and sexuality are very, very intimately related from almost a genetic level. I mean, they're intimately tied in a way that is really so far beyond the culture. People really haven't been looking into it. They haven't really thought about it as a relevant aspect of fertility or sexuality. Awesome. These are some great slides coming up for, I think they were out of Australia, but basically surveyed men and women in terms of the juicy stuff that people think about with cannabis, like how is it impacting orgasm or erectile function or satisfaction, sexual desire. Obviously, the red circles are the meaningful things to pay attention to. And what you can see here is basically almost across the board, overall satisfaction with sex was improved with cannabis. And then you can kind of get into the age differences and make what you will of it. The satisfaction with intercourse when cannabis is on board is really more prevalent in the younger folks, which could be a sign that they're feeling more relaxed, and sort of cannabis didn't impact satisfaction with intercourse as people were more experienced, older. And then sexual desire was actually improved in older folks who might be, otherwise declining in their sexual desire. They found cannabis especially interesting or engaging. Increasing orgasm in the younger folks, I'm not sure what to make of that. Maybe the older folks are just over it, and the novelty's worn off. And then IEF stands for Index of Erectile Function. I think it's International Index of Erectile Function. This, basically is suggesting that younger men, I think this is all men in this particular slide. Yeah, I guess erectile function, they probably weren't progressive enough to think about women in erectile function, but anyway, men have overall increased in erectile function with cannabis on board. And interestingly, one of the things that is a trend through the literature is that single folks are different than married folks. In general, more receptive of cannabis, more benefited by cannabis. That's what you get in the sort of middle columns here. All right, that's probably enough from this slide. Female sexual function, kind of what you would expect, I guess. Older women, this is sort of perimenopause and postmenopause, are getting more benefit of cannabis in terms of arousal, in terms of lubrication, in terms of desire. I think this needs to be out in the culture. I think women who are suffering with menopause and to some extent racing hormones as their testosterone is skyrocketing biologically. I think our culture, women in our culture have long forgotten the benefits of cannabis, and I think this is going to be a rager, so to speak, as the culture re-engages with cannabis. The more use, the more satisfying. One of the interesting things out of this female study was that when people consumed once, okay, it was good. When they consumed more, it was better. When they consumed continuously, is what this is circling here, that they felt like cannabis impacted their sexual satisfaction the most. They were most satisfied. And my interpretation from this actually is not that cannabis leads to more sexual satisfaction, but actually that the physiology of consuming cannabis continuously is an act of control. And I think as people are consuming more and more often, they have control over the ebb and flow of their natural endocannabinoid system. And my hunch is that's what this is referring to, because we don't see variations in a linear fashion from 1 to 2 to 3 joints, say, but we do see this leap in continuous. Aspects of enhanced sexuality for women. This is sort of zooming out a little bit, looking at, how are women viewing cannabis and sexuality? This is a little bit more detailed than the percentage survey I referred to a couple minutes ago. Basically, the punchline here: women have reported an increased desire of sex, increased sexual satisfaction, more lubrication, better erectile function, better sensitivity, sort of better across the board is the idea here, including sexual confidence. So most of the things I've sort of laid out, this is the data that supports it. Preferences for women. This sort of gets a little bit more real. This is interesting that this researcher asked these when when does cannabis improve or alter your sexuality, your sexual experience? And some of them are like occasionally, because not all people are going to be using this all the time. Do you prefer to be high on cannabis when you have sex? A bulk say no, but many say yes. And that's interesting because we don't imagine that people are even entertaining this question. But I think that goes to show that women who are consuming cannabis, do prefer it. I think that says a lot. How has cannabis altered your experience? Better or no change as most people. That's basically the punchline. This was an interesting finding, I guess, just about men. And for no particular reason, I don't think there's anything to take away. It was just an interesting finding that inability to reach orgasm increased with men. And I remember this being younger men, not older men. And that's why it was interesting, I think, at first, that we just saw this statistic, which was the opposite of that younger men tend to be more, have more erectile effects. And then here was another study that had the opposite. And then reaching orgasm too quickly, that's probably also younger men, and maybe they're just so overstimulated that that ended that way. This was an interesting study. It's sort of non sequitur, but in the same topic. This group of researchers was studying cannabis, and they actually picked terrible hemp, and it didn't have an appealing breadth of cannabinoids and components. And the result was that although they were looking for toxicity, the researchers were trying to show how cannabis was harmful. Because the cannabis was so crappy, so their logic goes, it actually improved sexuality and sexual function. And their logic was that there were fewer toxins in this crappy weed. And that's why they got improvements in the sexual function measures that they had in mind. It was just very ironic that people are so the researchers are so anti-cannabis that they punchline made. The type of cannabis seems to not matter. So if there are people watching that wondering, sort of, is it one type of cannabis or another? It seems for most of the studies, this is a consistent theme that the method of delivery doesn't seem to matter. The use frequency does. What you can see here is a lower odds ratio for use frequency, which means when people are using more, they have a greater effect. That seems to be consistent, but the way people are consuming doesn't seem to be significant, whether it's edibles or topicals or whatever. Another interesting factoid, conception doesn't seem to change when frequency of cannabis consumption is taken into account. So whether someone's consuming all the time or once in a while, the months to try to conceive doesn't seem to change, whether it's men or women. Which is an interesting argument if people are saying this is going to stop you from being fertile. This is a VISO, I guess. This is just a slide showing that cannabis use only, meaning no other substances, is not very common. That sometimes we talk about cannabis and we think, oh, well, that's all we're talking about, but really not. The people who are consuming cannabis, twice as many people are consuming cannabis and other substances. Actually, it's 3 times as many. And that's something we don't often remember, but is important to consider. When we're talking about cannabis, that cannabis is never alone in the picture. Interesting. This was, I think, a study out of men who had sex with men, and they're used to an unnecessarily large focus on sexually transmitted infections for that population. Basically, just shows that the same point as I was making before, that cannabis is not the only thing going on, that other substances are there, and there's no real difference in sexually transmitted infections with cannabis or cannabis and other stuff. This is also kind of a non sequitur, but interesting. Looking at relatives, 1st degree, 2nd degree, 3rd degree relatives, people who are related to someone who has experienced substance use, are they themselves more likely to experience substance use? doesn't mean it's genetic. It could be environmental, but cannabis is not the most loud voice in this picture. Although I think in our culture it sort of has been given an unfair punishment. This was an interesting study about DNA fragmentation, sort of disruption of normal DNA in sperm. And basically the punchline is men who were using sperm in this study showed that they had more deviation from what was normal. But interestingly, this study was repeated some years later, and they showed that when there was a 3-hour window between consumption and testing, I think it was actually they took semen samples later. There was less DNA fragmentation. So, like a lot of other literature we've seen in cannabis, in terms of dumbing people down and making people seem like they're cognitively deficient, if you just add a little bit of time, there seems to be an acute intoxication effect, which is different than any long-lasting, meaningful effect. This is just a slide showing cannabis does bind to sperm cells, and becomes relevant because a lot of the understanding of semen and sperm when it comes to cannabis is based on animal studies and petri dishes and not actual, real life. This slide was an older, this was sort of a cultural comment, that older studies, noticed that the overall sperm counts are declining in our culture. They're blaming it on all kinds of different things, including marijuana. This is really just a very narrow-minded vision of the endocannabinoid system of cannabis and how it impacts. But this is really the dominating, the prevailing culture idea right now. This is an illustration of sperm motility. Basically what you see is as you move right in this graph, there's a higher concentration of THC and less mobility in a petri dish. And then this is acrosome reaction. So for people who may not remember their human health from 5th grade, individual sperms sort of have their own ejaculation when they hit an egg. And it's not quite that, but it's basically a reaction which opens up channels into the ovum to be able to fertilize. That chemical reaction is called the acrosome reaction. That becomes basically less powerful or less active. It's almost like these sperm are lazy and don't execute their acrosome reaction. Interestingly, this one was married men. Basically, as men get married, they have less cannabis. And they also seem to have less of everything. So they're smoking less, they're drinking less, and it gets worse as they get more and more into a marriage. It's funny that they only look at men, but that was our culture. So this and the next slide are about men and women basically being all entangled. Men are not just sperm and not just sexuality, and just like women are not just ovaries and sexuality. All of this kind of feeds in, and when we focus too hard on one or the other, in terms of minute, sort of details about sexuality, we lose the fact that there's a whole other system that needs to be taken into consideration. All right, this is just a summary for folks who might be screenshotting. These are all the effects of the way cannabis can work in summary. This is what I went through at the beginning. Any questions? I almost took the whole hour just talking, so I apologize about that.
I have a question, Dr. Caplan.
Sure.
In regards to the slide that you mentioned that really caught my attention was the interaction between the endocannabinoid system and the fetal development, and how it really is from even preconception to the actual sperm and egg meeting. There's just so much that's intertwined with the ECS. When do you find, though I know it's a rather sensitive subject and there's still obviously lots of studies being done, but when cannabis use needs to be maybe not stopped, but dialed back or readjusted, how far along in fetal development should women be looking at their cannabis consumption in terms of the relation to the health of the pregnancy?
Right. It's a good question. Lots of controversy. I think the punchline, unfortunately, just as a clinician, has to be, it's a very individual thing. Women and partners who are trying to conceive need to discuss this with their doctors, hopefully in an educated way, meaning taking current data into consideration. There are three major studies that have looked at women getting pregnant, watching the babies as they grow up, looking at things which could be bad in terms of development, in terms of birth rates and successful births and issues with conception or birth or babies. The overall heuristic, the overall summary is that the later in pregnancy and the less volume of cannabis, the better. Also, the less smoked, the better. So in other words, if a woman can wait, not do it in the first week, not do it in the third week, maybe do it in the 9th month, that would be the ideal scenario. But that's not always realistic. And ultimately, there has to be a risk-benefit sort of analysis. Is me throwing up as a pregnant woman every day, all day long, feeling like I want to jump out a window, is that better than the potential risk of a baby having ADD or a female child having emotional dysregulation? The sort of repercussions of cannabis, even when it is used in a way that we wouldn't recommend, is still not the end of the world. I mean, we don't have in our culture, oh, that baby was a cannabis baby. We don't have, there are cultures now where cannabis is infused in everything that they do, whether it's soup or dessert or breakfast, and we don't have cannabis babies in that culture, in those cultures. We have potentially happier children. I think it's the assumption that most people make is that the way we do things now is correct. And I think that's not a fair assumption, because I think most people, particularly around the pandemic, but in general, we tend to okay stress and lack of sleep as if that's like okay, but then feeling the joy from cannabis is not okay, or having a child of a woman who has been vomiting the whole pregnancy. The repercussions to that child might be worse than if the woman had been consuming cannabis. If one focuses only on the cannabis, you sort of create crazy scenarios. Like the ideal would be, of course, not to have something outside of the woman's natural ecosystem. But if the natural ecosystem, if everything is not hunky-dory, maybe the cannabis is a better option. So it's a long way of answering it, but I have to be careful with the things that I say.
No, that was helpful. Thanks.
Sure. David, it looks like you have your hand up, but I don't know if that's from like an hour ago.
Oh, that's
Any
now.
comments, thoughts?
Can you hear me?
Yeah,
can you hear
yeah, better now than before.
All right.
Yes.
Very interesting. I learned a lot about cannabis and sex from a heterosexual viewpoint. My work, medical and research, has all been with men who have sex with men. And in fact, the 2 slides you showed from the Borback study are from the study that I started in 1983, following COVID at risk that are still going on. Just 2 comments. One, so much of cannabis' effects on sex and sexual feeling, I think, is very dose related. And if somebody is not used to it or is using a very high cannabis, there is a possibility of the opposite effect. Rather than getting relaxed and comfortable, that I studied, the real impact in terms of the way certain drugs are used. And so, for example, we have a small set of drugs like stimulants and erectile dysfunction drugs and nitrous drugs that together really do stimulate people having unprotected anal sex that are associated with at least 3/4 of all the new HIV infections that go on. So I'm not trying to give it a bad name. I'm very interested in seeing, for example, can the proper cannabis preparation replace those drugs? Can you get sexual stimulation without using the other drugs that are clearly having a very negative impact at this time?
Mhm. Yeah, I mean, David, two things stood out from what you were saying. One, you have to know what you're doing, and I think guided cannabis consumption is really going to be critical for the near future. I think until science catches up and we understand a little bit more, those of us like you and I who are in clinical cannabis, need to do our share and help people understand that, the right amount for the right person is a critical thing. But I think also, that just the simple idea that our concepts of sexuality have really grown up without an appropriate discussion of cannabis, and it's so critical. It's so front and center that I think really human sexuality is going to change completely as we understand cannabis at a more detailed level. So yep, it's good thing you and I are on board because we are few in number.
I hope you're right.
All right, so this has gone a little bit over, but hopefully it was a helpful discussion. Go ahead, David. Did you want to say something else?
Well, I hope your positive prediction comes true. I see a lot of research or clinical findings that try to normalize sexual activity outside of
Yeah. I'm a eternal optimist, and I think if the culture moves away from educated cannabis, I'm going to do my best to pull it as close to center as I can. I think we all I think the future depends on it. All right. I'm exhausted from talking. Hopefully this was useful. And all of the slides, all of the references, I should put back up here. If people want to check out where all this stuff is coming from, you're more than welcome. They are. Oh, I also forgot to talk about DIY stuff. So all of that DIY stuff is on our website at seedclinic.com/topical. You can find instructions for making your own salves, your own lube, your own face mask, body butter, lip balms. The recipes are right there on the website at cedclinic.com/topical. And then this is the references, the bit.ly/seedsex, where you have hundreds of papers there. All right, thanks for joining. Till next time.